Thank you. So first of all, I wanted to thank Dr. Gozar and the committee for allowing me to present this abstract. What we were looking at was at the Viance and Enteer catheters. There's a number of devices that we can use for crossing CTOs, but we looked at this particular one mainly to see if there's any variables we could use to potentially predict success or failure rates with this device. So with peripheral arterial disease, as we all know, up to 40% of patients could have chronic total occlusion as our presentation for PAD. Failure rates for these CTOs can range up to 20 to 25%. Some of the challenges that involve revascularizing CTOs include wiring the proximal distal cap, remaining true lumen, and re-entry after going subintimal. So with the Viance catheter, it involves an atraumatic low-profile tip, which ideally would access microchannels to allow it to remain true lumen. It creates a small channel that facilitates entry into the proximal cap, and it's compatible with 014 wires. Now, in those times when it does go subintimal, we can use the Enteer re-entry catheter, and what this does is it utilizes a flat-shaped balloon that takes the shape of the subintimal space, and then using an X-support facilitates selective guide wire re-entry into the true lumen. So what we did is we looked at 139 patients that presented with medically refractory claudication or limb ischemia, and these patients presented at 3 different medical centers in between December of 2012 and June of 2014. With each CTO, we analyzed the location of the lesion, the presence of calcification, presence of severe side bench involvement, and lesion length. The primary outcome was basically defined as successful crossing with the Viance Enteer catheter. Adverse outcomes were defined as device-related perforation, unplanned amputation, or death. So this is the overall success rate for the 139 patients with just the Viance catheter. 75 cases were successful, which is about 67%. When the Enteer catheter was used with the Viance catheter, there was 25 cases, and those were 89% success rate. Looking at the vessel location, majority of our lesions were in the SFA and popliteal artery. There were 10 cases in the iliac artery, and there were 7 successes in that group. In the SFA popliteal group, there were 78 successes, 78% success rate. We do see a drop-off as we go in the below-the-knee vessels. A little bit more than half was a success rate. So this chart looks at the primary endpoint, particularly in moderate to severe calcification. So if you look at the left 2 bars, these are all the patients that did not have moderate to severe calcification with their CTOs, and in the green are the successful cases. So you can note the higher percentage rate of success. When you look at the right, those are the lesions that did have moderate to severe calcification, so you do see a significant drop-off with the success rate. Mainly looking at moderate and severe side branch involvement. Again, the same thing. On the left are the lesions without moderate or severe side branch involvement. You can see a much higher success rate. And then as you go down to the patients that did have moderate or severe side branch involvement, you did see a drop-off in the success rate. So in conclusion, CTOs do remain a challenge for the endovascular specialists. There's a number of devices out there that we can use to revascularize this, and the choice of that depends on the operator comfort and the lesion. With this particular system, we hypothesize that severe calcification, severe side branch involvement, use in the below-the-knee vessels could be established as risk factors for device failure. Surprisingly, in this study, the lesion length was not associated with device failure, and there was a good safety profile with these patients because there were no adverse events noted.